This is Bob Maranto, Managing Partner of Andrews & Bernstein Maranto, continuing our discussion regarding injuries and things to look for in your medical records if you've had an injury to your spine. I'd like to talk a little bit more about radiculopathy. And radiculopathy comes about when a disc in any part of the body is pushing to one side, left or right, and causing what we call foraminal, which is the foramen, this hole where the nerve is coming out, stenosis, narrowing. And when that happens, that disc can touch the nerve, causes a thing called radiculopathy. So you know if you have something in your medical records that is notated as radiculopathy, this is where it's coming from. It's coming from an exiting nerve root. And people say, well, how do we test for that? There are tests available to determine whether you are suffering from an active radiculopathy. Number one, doctors will do it clinically. Clinically meaning they say to you, okay, well, what's bothering you? And you describe a certain finger or two certain fingers that are numb, or they are weak or having some type of symptom. And then they know, the doctors, that they can trace that symptom or that part of your body back to a specific area in the spine. So if you are describing that you are having a problem with down the back of your leg, and to the right-hand side, they would be suspicious that you have a right-sided L5-S1 disc herniation causing foraminal stenosis narrowing. But in addition to that, there are things that doctors can do to test the nerves. The most common way of testing the nerves to determine if you have an active radiculopathy is called an EMG-NCV test. And it's a nerve conduction velocity test, electromyogram. This test consists of using electricity to determine if the nerves are firing properly. And what the doctors will do is that they will take little needles and they will insert them in certain areas of the body where there's a suspicion over an injury. And they run an electric current between the two, and then they measure the current. And if there is an impact to one of these nerves, it will be displayed on that EMG. In other words, the electrical impulses will be disturbed, and they'll be able to tell and trace back that nerve to where you're having the problem. So you can imagine if you're having symptoms, I'll say again, down the back of your right leg, and we take an MRI of your back, and we can see that you have a right-sided disc herniation, which is causing effect on that exiting nerve root. And they run an EMG that shows that there's an electrical impulse there that's been disturbed, that we now have complete clinical correlation and we know exactly what's causing your problems, and now it can be addressed by chiropractic, pain management, or neuro or orthopedic surgery.